68, but let me tell you how we're going to do this. Let me find the page and tell you. Oh, bless you, darling. Okay. You're going to go to 553, so you're going to take 2 pencils. You're going to bear with me now. You're going to put a pencil on 553, and then you're going to put a pencil on 577, or fold your page. Now, okay, so I'm going to go nice and smooth because this can get very, very rough. Diabetes. I'm going to do it 2 times. I'll do it in Creole and just do it in English. I'm going to do it like 2 times, okay? Don't worry. You're going to put a pencil. Guys, hello. You're going to put a pencil or pen, whatever you have, on page 553. And then you're going to take another pencil and put 577. Okay? Now, I'm going to do the lecture without the microphone, and then I'm going to get the microphone because I got to work on the board. Okay? I'm going to do it because I have to write it, and then I'm going to get the microphone. Then I'm going to do it again. I'm going to do each segment about 4 times. All right? So you don't have to tell me microphone, I'm going to get it. Okay. Yes, ma'am. Yes, ma'am. The shh. Okay, guys, I'm going to need you to... People got to take this in. Okay, there is 2 types of diabetes. There is a diabetes called diabetes insipidus, and there's a diabetes mellitus. Diabetes insipidus. Okay, all of this you learn in endocrine, but right now we're going to talk about diabetes mellitus. Diabetes mellitus has to do with pancreas, and this one has to do with kidneys. Okay? We are working on this. Right here, diabetes mellitus. We are working on this. So I'm going to erase this. The reason I put this because the students don't know the difference between diabetes insipidus and diabetes mellitus. Now, I'm going to get the microphone. Chill out. When we're talking about diabetes mellitus, this is how the body functions. The normal process of the body. Watch. Shh. Okay? Look. This is Yaya, me, you. Right? With some hair. Shh. This is Yaya. Right? Us. This is normal process of the body. Normal. Shh. Now, you eat anything you want to eat. Dunkin' Donut, rice, peas, banana, anything. The problem with the students, you think diabetes has to do with the food you eat. No. Type 2 diabetes has to do with weight gain. So make sure we get that on point. Diabetes mellitus, right, has to do with the pancreas. So here it is. I eat whatever I want to eat. And I'm going to say Dunkin' Donuts. The problem with students, the students think it's only sweet things. No, no. Black people will say, girl, you better stop eating all that sugar. You're going to get diabetes. Wrong. Wrong, wrong, wrong. So I eat Dunkin' Donut, rice, whatever. I eat. Once I eat this, it turns into what we call fructose, sucrose, sugar, right? So it turns into fructose, right? Now, so this food turns into sugar, right? Now, so this is the sugar. This is the pancreas, and I'm going to get the mic. Right? So, I eat whatever I eat. This is you. We'll say rice or Dunkin' Donuts, whatever. It turns into fructose. Fructose is sugar, and the sugar goes into the blood. The sugar goes into the blood. Now, Mr. Pancreas detects sugar in the blood. Mr. Pancreas detects sugar in the blood. So, Mr. Pancreas set a hormone called insulin. So again, I eat, it turns into fructose, which is sugar. The sugar goes into the blood. Pancreas say, oops, I see sugar in the blood. So pancreas sent a driver called insulin, which is a hormone. Insulin picks up this sugar, scoop it up from the blood. Now, this insulin has to do something with the sugar. This insulin pick up the sugar from the blood. It has to put 50% in a bank and the other 50% to the body. So I can teach, I can dance, I can sing, I can study. Any question? So let me get my microphone. The normal process of diabetic mellitus. First of all, diabetic mellitus is a disease. We're not even there yet. Don't look at this. The normal process, how the body functions, right? If you don't have diabetes, you eat whatever you want to eat. Whatever you eat can be rice. You know why I changed Dunkin' Donuts? Because students think if you eat sweet stuff, you're going to have diabetes. And when I get to the different type of diabetes, I can help you a little bit more. So, I eat rice, Dunkin' Donuts, whatever. It turns to fructose. Fructose, which is sugar, goes into the blood. Any questions so far? Row 1, question with this little bit so far. Row 2, question. Yes, ma'am.
When you said whatever, when you eat rice, you mean vegetable, anything?
Anything you eat, lo manger that when I'm living sick, right? Okay? Fructose. 3rd row, question. So far, what? So far, right here. Any question? 3rd row, yes, ma'am. Yes. This is how the body functions. Don't even look at diabetes. We eat whatever, Dunkin' Donut or rice. It turns to fructose, which is sugar. The sugar goes into the blood. Mr. Pancreas say, hi! Oh my God! I see sugar. I have to go pick it up. The pancreas cannot go pick up the sugar. The pancreas has to have someone to do it. The pancreas secrete a hormone called insulin. Insulin go pick up the sugar. Now it's in my hand. The sugar has to go 2 places. 50% goes to save, which is called what? Glucagon or glycogen, y'all call it. And the other 50% goes to the body. Any questions? Now, when you have diabetes mellitus, there is 2 types. type 1, type 2. Type 1 and type 2. Now, type 1, it is genetics. You're born with it, right? You're born small, you're born with it. What is it, right? The students here, oh, the 3 P's, polyuria, polyvision, polydipsia, I got that. But let me tell you what is type 1. Look, I eat whatever, it turns into sugar. Sugar goes into the blood. The pancreas does not secrete the insulin. So where is the sugar? In the blood. That is where you have polyuria, polyphagia, and polydipsia. Because there is too much sugar in the blood. Any question? Yes?
Why the pancreas is not separating the insulin?
The pancreas, remember, type 1, it is a few reasons. The beta cells, you probably just don't have them, born with it, or they're damaged. The beta cells is what's in the pancreas. And when you have diabetes type 1, it's normally either damaged or it's just not. It's not working like it's supposed to. Any question? So, since our problem is insulin, I'm going to talk about the insulin drug now. You see it? So anytime someone asks you about type 1 diabetes, what are you going to say? Lack of what? Insulin. Now here it is. Before I go to the insulin drugs, type 2 can go to type 1. Type 1 will never go to type 2. But you can come here to go with me. Any question? Row 1, question. Okay, look. Type 2, which I didn't even talk to you yet. I just want you to keep that in the back of your head. Type 2 can go to type 1. Type 1 will never go to type 2. Parce que type 1, c'est lui-même qui est grave à c'est ça. The worst of the worst. Yes? Type 1 has to do with the pancreas. The pancreas will not secrete the hormone insulin. Any question? Second row. Shh. Take it in. Third row. Fourth row. Katuska. What's the problem? You're going to get it. And that's why I'm telling you, people need quiet because they're trying to get it. Now, yes. Polydipsia, polyphagia, and with type 1, the patient is normally weight loss. Any question? Now, let's go into page 577, the insulin. 577, the insulin. So you got 576, 577. I want everybody to go to 576, and there's going to be some changes. You're going to go to the box. To the box. Go to the drug box. This. Right here. Okay. If you have your little purple book, go to 674. you're going to make some changes for me. Right? Let's go in the box 45-2. Okay, on the top you should see brand, onset, peak, and duration. True? Okay. Onset, I want you to put start. Commencer. Onset veut dire qu'il les médicaments commencer travail. Onset means start. I want you to put start. You with me? Peak, I want you to put when is the drug the highest in the blood? Highest. Highest. So guys, if I say something is the highest, isn't that the when I'm going to see sign and symptom? Yeah. So another word put next to it, put sign and symptoms. When you will see sign and symptom in the peak. Peak mean war. So when is the drug the highest in the blood? Duration, how long it will stay. How long it will stay. No more? So again, onset. Start. Okay? Peak. How long? Now how long? Highest, excuse me. Duration. Highest in blood. Now, onset for Novolog, where it says rapid, you see the 0.25. I want y'all to put 30 minutes. Everywhere where you see 0.25, I want you to put an X and put 30 minutes. 30 minutes. 30 minutes. Where it says 0.25, I want you to put 30 minutes. You got it? Everywhere you see 0.25 in the rapid, mama. So you only see 2, you put 30. Because the last one I already got the 30 minutes. Now, go into short. You see 0.5. Short acting. I want you to put 1 hour. Just, hell, change it 0.5. Just put hour. All of them. 0.5, 0.5, 0.5. I want you to put 1 hour. Any question? Who do not see what I'm seeing? Who do not see it? 30 minutes, multiply 4, baby. 0.5, mettez 1 hour. You with me? You see? Show her. You got it? Okay. Now, I'm going to teach you something that cost me $120,000, but I'm going to teach it to you for $900. Ready? I'm going to teach you a trick, and promise me you will never forget this trick. Say it, never. Never. You see where it says rapid? You see rapid? I want you to say, anytime I see a log, it is rapid. Anytime you see a log, it's rapid. Nova log, human log, mama log, henna log, any log. What's logs? Rapid. Good. That cost me $120,000. Right? Now, anytime it's an R, you see an R, it is called short. Human R, noble R, 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 it is short. Log is what? Rapid. Rapid. Any question? You see I showed you a little memorization. Yes. Okay. Now, log, honey, there's no trick, baby. Okay, intermediate. All you gotta say, lente and pH. Intermediate and pH, right? Lente, sorry. That's, they didn't show me no way to remember that. Now, intermediate, I want you to remember NPH. Intermediate, NPH. Intermediate, NPH. Lente, NPH. Lente, Okay? NPH, intermediate. Lente, intermediate. Long lentis, long lentis, long lentis, long lentis. So let's go. Rapid are my logs, short are my R's, intermediate, okay. Now, and then long is what? You see how you remember it? It's going to stick. Okay? Now, here is where I murder you dead. Yes. So now, here is where it get hard. Let's go to rapid. Let's go to unset. You remember you changed that to what?
30 minutes.
We changed the 0.25 to what?
30 minutes.
Stay with me. So watch. The doctor ordered a log. Watch. At 11 a.m. Oh, bon Dieu. So watch. Carol, I'm here to give you your insulin, and I have a log for you. It's scheduled at 11. NCLEX asks you what time you will see, what time should food be on the floor. Look at what Miss Sonia teach you. Onset mean what? Start. So class, you got to what time to make sure food is on the floor? You got up to 11:30 because the drug going to start what? After 30 minutes. That's where they get you. The students think, well, 11, the drug don't start working till 11:30. So that's why they say you can give the patient the food 30 minutes before or 30 minutes after. Okay, again. Let's go to a law. Nouveau law. Doctor ordered it for Karen at 11. Now, I go, Miss Karen, I got this drug for you. Now, I'm asking you, what time I should have food for Karen? Give me the time. So I can give Miss Karen food 30 minutes before or 30 minutes after. So if NCLEX have 10:30, take it. If NCLEX have 11:30, take it because the drug starts working after 30 minutes. Any question? Row 1. Take it in, calme. Take it in slowly. Slowly. Row 1. Let me tell you something. Students never. Remember, there's 4 topics of mine. Students murder NCLEX. EKG, endocrine, like hypothyroidism, endocrine, you kill, EKG, ABG, and psych. My students, and the infection control, right? Airborne droplet, who you could put room in, you kill them dead unless you got other stuff going on. Yes, mommy. Question. Yes, what you see. Shh. Got to put going on anyway. Remember, the drugs start working. So guys, please. So the drug doctor ordered at 11. When does it start working? 11:30. So I can give the lady And I also can give her food with the insulin. So come on, baby. So 10:30, 11 when the doctor ordered, and I got up to 11:30. Because anytime after 11:30, the drug is working. You got it? Yeah. You could give it 10:30, you give it 11, but by 11:30, you better make sure that lady got food, because that's when the drug gonna start working. Huh? Yeah, that's why people say 30 minutes before, 30 minutes after. Right. Now, look. Pete, so NCLEX say, when would you see the lady start sweating? Tremors. Look in your book. Look in your book. So listen, I gave her the drug at 11. Stay with me. The drug started working at 11:30. So if I don't give Mary food, when will I start her sweat and sugar go low? 11:30. So 11:30 the drugs start working. So 12:30 the lady could start going to hypoglycemia. So 1:30 the lady dead. 2:30 you find the lady dead somewhere. So you got, so NCLEX asks you, when would you see sign of hypoglycemia? And they not gonna put hypoglycemia, baby. They gonna say the patient tremor, diabetes, that lady is in hypoglycemia. So you know it happened where? 12:30 on. Any question? Take it in, front row. Talk to me. Yes.
Is it 1 hour after the medication, to give the medication, or 1 hour after the medication starts working?
No, it's one. Shh. The medication, the doctor gave it for me to go give it at 11. Shh, shh, shh. Please, please. So I gave it to her at 11. 11:05 is still in her blood. 11:10 there. 20 there. 11:30 the medication start working. So I gotta make sure that lady will eat, and if she's not eating, by 12:30 the lady can start going into hypoglycemia, because that's when it start the highest in her blood. Yes. Second row. Okay. Shh. Third row. We cool? Okay. You gotta take it in slowly and try to break it down. Okay. Yes. No, baby, the book say that. 1 to 3 hours. That's when it's highest. I didn't say that in beat. Show her what the book, baby. The book say that. No, but if you got the book you have is in it too. 1 to 3 hours when it's the highest. Okay? Now it say right in the book. Yeah, and last for 5 hours. You see that, Mom? We cool? All right, before you leave, I'll show you. Yes.
Is it 5 hours after the peak, or
No, once it's, no, the duration is from 11:30. You see? Question. She asked a question about the duration. Good question. The duration is from the time the drugs start working. I gave it to him at 11, but the drug don't start. The drug reached the blood 11:30. So the duration 11:30, 12:30, 1:30, 2:30, 3:30. So the duration is from when the drug start working. Yes. Okay. Any question? You can give them the food, listen, to prevent hypoglycemia. You want to give the food 30 minutes before, or you got 30 minutes after. Okay, that's what they say. So 30 minutes before is what? 10:30. You could give it 10:30, 11. By 11:30, you should have given the food. Because 11:30, that's when the drugs start working. Look, mommy, watch. Watch. Let me show y'all what happened. Watch. If this is not there, so that means I did not eat, right? and pancreas send insulin. And insulin go, ain't no sugar to take. Look, this, let's take this out. Insulin, when the pancreas secrete insulin and it go look for sugar. Insulin gonna go take every sugar that is in your blood. So where am I gonna find you? On the floor. Doing it. It doesn't matter. 11 o'clock you can get it. Don't be sure you give it before it start working. Look on the board. Stay focused on the picture. It makes sense. This is the food. Suppose the tray wasn't on the tray wasn't on the floor. You go give the lady insulin. So I gave it. Insulin go put, its job is to go get sugar. Right? So it go get the sugar you didn't eat. So every bit of sugar you got in your blood, that insulin don't take. So where are you going to be? Dead. Yes.
Okay, so what if you're,
But it's, listen, okay, listen to what my little girl said now. You ate, let's give a time, 9 o'clock. Right? 9 o'clock. Patient ate 9 o'clock. Hold on, dear. How long it takes food to digest? 2 hours. 10, 11, no good. You see? Makes sense. Bring the questions. You see, well, law comprend, whatever the student asks, you can answer. Listen to what she said. She said, what about the patient ate not around 10:30 or 11, but way before? It ain't gonna be of use, baby, because the food already digested. Now remember, you're gonna have some sugar in your blood, but the insulin won't take all of it. Yes.
Is it the same purpose when you go to do a sugar test, they ask you to do it before?
Yeah. It's called GTT. I'm gonna talk about it. Okay, now, here's the thing. Insulin has 2 jobs. Forgot to tell you. Insulin say, yes, miss, I'm gonna remove the sugar for you. But while I'm removing the sugar, I'm going to take some potassium. And that's why anytime you give insulin, you must give the patient potassium. RN, anytime a patient comes to the ICU with diabetic ketoacidosis and you give him regular insulin on pump, you must give the patient potassium and put the patient on heart monitor. Again, diabetic mellitus patient don't have potassium problem. It's when you give them the insulin. The insulin put them in heart problem. Any question? So insulin has 2 jobs. Insulin removes sugar, and insulin say, hey, while I'm removing the sugar, I'm going to remove what? So RN, anytime you put a patient on insulin pump IV, because regular insulin is the only insulin that goes IV, you must give the patient potassium pills. You must put the patient on heart monitor, EKG.
That's why they can ask you a EKG question about
That's why they can ask you, girl, you got it on point, baby. That's why I asked you first before NCLEX asks you. That's why I can ask you an EKG question with diabetes. Of course, why not? Let me get her and I'm going to come to you. Yes.
a little confused. In type of diabetes, she said the pancreas secreted.
Do not secrete insulin. Type 1, the pancreas does not secrete insulin.
So,
Type 1, mommy, look. Type 1, you eat Dunkin' Donut, whatever you want to eat, turns into sugar. Sugar goes in the blood. Le pancréas, ouais, ça, c'est pour pancréas voyer insuline. But de pour gen type 1, pancréas la pas travail. So, tout cyclarité qui côté dans sang. Créole, ça, long matin. Right?
So that's one population of going.
Okay, so, okay, let me give it in English. Look, the normal process, people who don't have diabetes, this how stuff work. You eat whatever you want to eat. It turns into sugar, fructose, glucose, whatever. That fructose is sugar. Where does sugar go? Into the blood. We cannot leave sugar in the blood, because if you leave sugar in the blood, the body needs sugar for energy. So therefore you become weak. So here it is. When the pancreas detects the sugar in the blood, the pancreas now secrete a hormone called insulin. The insulin goes. See, it's not the pancreas that goes. The insulin goes. Pick up the sugar and take it. 50% in here, 50% in the body. And while the insulin do that, the insulin say, hey, I'm going to remove your sugar, but I'm going to take some potassium too. And that is why any time a patient is on insulin, you must give them potassium.
This is where it might come from.
Why is where you're concerned?
This is for only people who does not have any diabetes, with pancreas second that hormone called insulin.
Yes.
Go to the blood and then
Pick it up.
right?
Yeah, that's normal.
That's
Normal.
So, okay, people who have diabetes, we inject the insulin, we have to give the potassium, and then.
Yes, yes. All right. All right. Okay. All right. Yes, ma'am. IV. Shh. Come on. Yes. Yes. Let me tell you. Shh. Anytime you give insulin, I don't care how old you are as a nurse, you must get a witness. Not only IV pump, baby. Insulin, you never too old, meaning too old in the career, the field, to not go get a witness. Because guys, insulin, you cannot take it. Oop, I'm sorry. Oop, I gave you too much. Hey! Insulin, you cannot take that. And you know, our eyes sometimes get weak, and what we see is not what it's supposed to be. Okay, we got bigger fish to fry. I gotta mix the insulin, guys, so you gotta hang in there. Any question?
So, last one question.
Go ahead, Alexander.
Then we are giving insulin by IV, but then we need to give the potassium, right?
Anytime, not on A, you have good question. Not only IV. Any insulin you give, you gotta give potassium.
So, it's not when I am going to working.
Guys, be quiet. Hey, I'm getting mad. We talking. That's why people can't understand. Shh. Come on now. Yes.
When I am going to working in a facility, I need to give insulin patient. So same time give potassium.
Yep, the doctor will have
Oh, okay.
potassium.
Thank you.
Yes, question. Big.
You go home here, for example, you go to you don't know then on potassium.
You better know you got a damn license. Ooh. Ooh.
Not every food, that's what I said, not everybody on
bet you, listen, not everybody on potassium. There's something the patient will tell you when they take insulin. I have leg cramps. You must know. Guys, remember, the doctor job go right. Your job as the nurse, you're the advocate. You automatically, anytime you go into a patient house, Miss Lee, why don't you take your potassium? You have aches at night. Your heart beat fast. She said, yeah, baby, how you know? Remember, you patient advocate. Even metformin, who's, I'm not there yet, even metformin, who works, it's a PO med, but it also helps with insulin secretion. They give you potassium with metformin because metformin causes an adverse effect called lactic acidosis, called Z, called lead. So you gotta give these people potassium. Anytime these diabetic stuff you giving people, that's why when you're home care, remember they tell you, and don't get mad, people say, you are LPN and you work in people's house, you ain't no real LPN. LPN, you're supposed to go work in a facility, in a hospital, where you see things. The patient cannot be on insulin, ain't no potassium. The first thing that patient said, at night I can't even sleep. My muscle hurt, my chest hurt. And you'll say, call the doctor, but call the doctor for what? You gotta know, guys, your role. Okay? Okay. Yes. You, Dr. Lee, Dr. Mark, I see Miss Lee on insulin. Do you have potassium? He'll say, oh my God, I'm sorry, let me give you an order. Girl, and he gonna tell you, thank you on Christmas, wait for your nice gift. You just helped his ass, okay? Trust me, because you helped him. Yes.
So, like just saying, if they're not on it and you see they have bananas in it, and you give it, could you just say, okay?
Yeah, you can say, Miss Lee, you can drink orange juice if it's not contraindicated with other medications she take. You can eat potatoes, you can eat tomatoes, other things to help. Yeah, you can teach them stuff like that. But I'm telling you, anytime you take an insulin, trust me, the lady got some muscle aches. Yes.
If you have been with a doctor for so long and they prescribe you metformin, because that's my first time I learned that, and so what you should tell that doctor?
Oh, okay. Keep that when I get to the metformin. See, let me explain something to you real quick, so that'll give you a heads up. Now, you know I should have been far in this chapter. Now, this kind of taking me too long. But anyways, it's okay. Listen, you remember Miss Sonia say insulin, the pancreas work on insulin. So you were supposed to ask me, Miss Sonia, what does the PO med work on? The cell. Because listen, type 1, the cell open, but the pancreas doesn't secrete insulin. Type 2, which is this obesity, this works. But when you pick up the insulin don't have nowhere to take the sugar to, disclose. So we give you metformin to open this cell. We give you glyburide to open this cell. We give you Actos to open this cell. The purpose of the PO med is to open these cells. Any question? Type 2. I just wanted to show her. Because she said why. She asked why with the metformin your sugar was high. Type 2. Okay? Any question? Now, then we go to Lantus, which is a what? Long. Go to duration. Okay? Look at peak in Lantus. What is peak? What is it peak? So what does that mean? No. Look at the peak. What is the peak? None. So what does that mean? No sign and symptom. So anytime you're newly diabetic, the first insulin I'm going to give you is Lantus because there's no peak. Lantus, there's the best. That's the best because there's no peak. So it's very hard for the patient to go into hypoglycemic crisis. That's why Lantus better, because if I'm a new diabetic patient, novice mean new. I don't know. Even you tell me what to eat, I still don't know. So that means I'm at risk for what? Hypoglycemia. So if you put me on Lantus first, that'll give me chance to what? Learn about diabetes. Anytime you see the patient a newly diabetic, the first insulin they will give you is called Lantus. Any question? Who don't understand? Yes. Lantus, look in your chart. You see where it says long acting? Go to the peak. You see none. True? Okay, Mom, I'm gonna need you to sit up front, cause like so I can show you, because she can't help you, because y'all both new, and she definitely can't help you. So we need somebody to show her what I'm talking about, because if you could see it in the book, it makes sense. Yes. Yes. Yeah, very new. So it new back. Yes, there's no heat. Levemir is good. Yes, it is. Okay? Okay, so let's continue. So you see that? Yes. Now, so insulin works on the pancreas. The PO med works on the cell. We have not got here yet. I just wanted to show her. Okay, and we have not talked about type 2 yet. Now, here is where the skill for you. You need to know how to mix the insulin. Okay? When you're pregnant, and you have gestational diabetes, which you learned in OB, we cannot give you metformin. Why? Because placenta abruptio. The only safest is regular insulin. So even pregnant woman, when you are taking regular insulin, you must take what? Potassium. And your prenatal vitamins, you never take metformin. So here is the bottle of insulin. Francis is going to hold for me, right? This is NPH brown, NPH, black is regular. Okay, NPH up, regular. Now, you need to mix it. NCLEX asks you to put it in order. The doctor ordered 40 units of insulin. You cannot, but he wanted mixed. He wants 20 NPH, 20 regular. That's how he wants it. Now, before I go to mixing it, let me tell you about insulin. A lot of insulin is made of pork, right? So NCLEX can ask you this in a culture. Who cannot take regular insulin is made And lentis is made of pork. Okay? So let's go. Jehovah's Witness cannot. A lot of Muslim. 7 days. So very big. Regular insulin. Lentis made of pork. So you want, and they call them synthetic. So if for religion, you want to get non-synthetic for those people. Any question? Now, before I mix the insulin, hold on, baby. Where is insulin kept? Listen, if you brand new, non-open, refrigerator. Now, refrigerator, and then once you remove it from the refrigerator, you gotta leave it in room temperature. Now, what NCLEX want you to understand, some people house is 69 degrees. My house, it's always 69, 70 degrees. My mom's house, always 85, 90. Right? Because she said, I ain't trying to pay no bills. Okay, now, what do you know about older people? They're always cold. Right? They're always cold, these older people. So their temperature is 90, 85. So if I tell Miss Lee, take her insulin out of the refrigerator and leave it in her hot house, it will turn brown. That is why they say, put every insulin in the refrigerator. But remember, for NCLEX, brand new refrigerator. Once it's open, room temperature. Any question? We cool? Now, here it is. NCLEX asks you how to mix it. First of all, an insulin needle is so small, people. Insulin come in units. Units, not units of blood. Ugh. They're so small that a baby gets stuck, they'll be all right. The needle's so tiny. Insulin is always given sub-Q, fatty tissue. Fatty tissue. So before I tell you where, let's mix it. First thing I do, I go in the room, I wash my hands. I wash my hands. Then I come, hi Carol, my name is Sonia, I'm here to give you your insulin. And if she have any question, you see, I didn't put gloves, I'm talking to her. I wash my hands and I'm talking to her. NCLEX asks you, when do you administer the glove? Be outside, in the patient room, prior to administering the medication. Why I got glove in my hand, I'm talking to the lady. That's rude. You don't do that. Wash my hand, I talk to her. Okay, if I touch anything, I will wash my hands again. But if I'm just talking to her, and now it's time to administer. Mixing, you mix with gloves on. You mix with gloves on. You don't go mixing without gloves. So let's go. So, first thing I do, so I talk to her, right? And I'm ready to mix, so I put on my gloves. Regular gloves, not sterile gloves. Regular gloves. Now, they tell you insulin should never be mixed at the MAR room. It should be mixed at the patient, in the patient room, at the bedside, so the patient can see what they're getting. Ready? So, I put on my gloves, and I'm ready, right? The first thing I do, because the patient's getting, I already checked the patient glucose, and the normal glucose is 70 to 110. So we'll say Cowell blood glucose 150, which is awesome for a diabetic patient. So we'll say 150. So, and it's right in the book, 577. It's steps, step 1. You see it? Step 1. So what I did, I shake my NPH, which not shake like this. I should use the different word. I roll it. Roll, yeah, to warm it. And anytime a patient insulin is in the refrigerator, you need to tell them remove it 30 minutes before. 30 minutes. So I rolled it and I give it back to Francis. So look, I roll it, I clean the top. I clean the top and pH, garbage. I get another alcohol swab, regular, garbage. Now I pull 20 air. Air first. Everybody say it. Air first. 20. I take my NPH bottle, I go chew air. Pull it out, my needle. I put the air in here, and that's fine. I take 20 more air, and I put my regular air. Boop. Now, where's my needle? In the what? In the regular. So I take it, and I turn it over. I back, and I pull 20 regular. I look 20. I don't have to go get this one witness. This one. It's when I put the other one, I got to go get it witness. So my regular is in here. So what's in the bottom? 20 what? Regular. Regular. Regular first. Then I go get my NPH, right? And then I pull 20 more. Then I go get Shakita. Can you come see that it's 40? She checked. It's 40. And if it's more, she'll check it. Make it 40. And now I'm ready to administer. Any question? So, what goes in first? Air in NPH. Air in NPH. Take needle out. Right. Air in NPH. Take needle out. Okay? Air in regular. And pull regular insulin. Right? Then pull NPH. And get it what? Verified. Any question? Now, NCLEX asks you where to administer it. Do the Macarena. Let's go. Your arm. Right? Where else? The stomach. 2 inches from the belly button. Now let's talk about the belly button. Let me help you. So the belly button is here. Now, the correct way to administer insulin is you want to use 1 quadrant for years. However, since Miss Lee is blind, Miss Lee could stick herself again. That's why they tell you to change spot. You never give insulin and then swab after. Never. You use the alcohol swab in IM injection. Insulin sub-Q, fatty tissue. So you can teach the patient to give themselves there. Some patients do the legs, but never there, because they can't see. You will have to give it to me there. Insulin is not given no doggone deltoid. IM muscle right here. How can the patient see back here? So you will do that. But the classical spot is abdomen, 2 inches from the belly button. Any question? Yes? You can do this quadrant, the next day you tell them the next, rotate. They tell you rotate site because of eye. Any question? Hold on. Yes, let me get her mommy knock up to you. The purpose of the air for bottle expansion so to make the medication easy to come out. No baby. The air in a needle la, it will make it not in pH la. So we can lò employé LPH, ça can easily come out. Le médicament can sorti facile. More easy. The purpose of the air so the medication could come out. Let me give an outcome to you. Yes, ma'am. Yeah, that's the purpose. Yes. After I put the air in the NPH. Yeah, after I put air in the NPH, so now the NPH open, but we don't do nothing with it yet. Then I pour air again and I go to my regular, put air. Because I'm in my regular, I then pull out my regular. Yes, and then you pull out. Any question? Yes.
The needle is so thin, you don't change the needle because you
No.
can't hurt the person.
You don't change nothing. Very thin. Guys, if a baby, I mean, you don't want kids to play with insulin either. But if baby gets stuck, they will die. It's not damaged. The needle's so small. Guys, insulin never come in ml. Or if you give somebody insulin in ml, you just kill them. I will see on channel 7, CNN, MSNBC, Fox. Right? Any questions? We cool? Cool. Yes, go ahead.
Do we aspirate to the side of the
No, you only aspirate IM. IM. Yes. It's called non-synthetic. If you read behind non-synthetic, if I gain port, if I gain, there's certain things that I don't have. Non-synthetic. All right? Yes. No, because it's not, you don't care about the food. Not the food, my concern. Lentils, there's no P. It's hardly ever you'll see a patient on lentils go into hypoglycemic crisis. Not you don't care about the food, baby. C'est pour buy manger. But it's hardly ever. Yes, that's why they give lentils at night. If you leave it, you should snap it. Yeah, oh, of course. Listen, the lonely sugar is 70 to 110. The lady blood sugar 70, you go give lentils. It'll bottom out, okay? No, that is understood. If it's low, you go give lentils. Yeah, always check the blood sugar, always. Anytime you give insulin, you gotta check blood glucose. Anytime you get blood pressure, you gotta check blood pressure and heart rate. No, if it's normal, you still give it to them. Listen, remember the insulin is not when I want it, how I want it. Just like I got blood pressure med, my blood pressure is 110, right? But I'm on blood pressure medication. My blood pressure 110, you still gonna give it to me. 90. If the patients tell you, oh, it's 70, you don't have to give it to me, I'm good. You gotta know the patient. It's right in the chart. If the blood glucose is 70 or lower, hold it. Like there's instruction. Yes. They have instructions on what to do. Yes. 70 to 110. And that will go more detail on that tomorrow. Yeah, it's a lot. Okay, tomorrow we still on endocrine, continuing drug, it's a lot. And what I got tomorrow, I have endocrine and endocrine disease. Yeah, all the class, I got endocrine disease. So your calendar, now remember we not finished, so we still on this mañana. See, that's why if you miss endocrine, and this is endocrine, we got hyperthyroidism. We got deep stuff, things that students never understand in nursing school, make you want to quit. 2 systems, that make students quit. Well, really 3. The EKGs, the endocrine, and the cardio. Hell, you don't come back. You quit. ABG's not bad. So tomorrow, endocrine disease. We going deep. Okay? Alright? I'll see you tomorrow. Alright? Test taking strategies at 1. See you tomorrow. Thank you.